Hello and welcome to Talk to the Experts here on 770 CHQR. I'm Betty Jo Kaiser, and joining us today is the director of the HeartFit Clinic and author of Beating Heart Disease, Diamond Fernandes. Welcome, Diamond.
Thank you very much.
It's so great to see you. I know you are fresh off a big trip. I cannot wait to hear about it because you were keynote speaker, not once, but twice. And I'm excited because a friend of mine, his father just had a bunch more stents put in.
Yeah.
Okay, so if you're driving around in your car and you're tuning in and you're listening and you're like, stents? My brother had a stent put in. I had a stent put in. You absolutely have to stay tuned. Let's get things started by just talking about the HeartFit Clinic and what sets you guys apart. It's a special place.
Yeah, absolutely. And I think, the HeartFit Clinic is a very innovative clinic on helping people understand where their risk is of heart disease. And more importantly, how do we treat heart disease? And so we like to prevent heart disease and reverse heart disease. Those are the two big things. So we have two different people that come into our clinic. Those people who want to know what their risk is of a heart attack or stroke. So if you have a family history or you just having some tingling in your chest or, you're worried about something like that, you come to the HeartFit Clinic. Right. That's what we do. We specialize. We have the best tests to see where your risk is of that heart attack or stroke. And I'll talk about it a little bit later about how we differ than going to your cardiologist or your doctor, because we'd like to work with them. And we do get referrals from them, but those people that understand this big gap that we're filling in the healthcare system. So
you basically have a toolbox that they don't have.
Exactly.
Okay.
And then the second population that we see is those people that do have coronary artery disease, heart disease, diabetes, heart failure. So that's the next population that we help patients with as well. So
excellent. Love that you work with family doctors, you work with cardiologists. Everybody's all working together to prevent and treat heart disease. And the HeartFit Clinic, actually right here in Calgary, you can reach them at 403-870-4348 or long distance at 1-877-700-4348. Check out their website, heartfit.ca. That's going to give you tons of information as well. So Diamond has this awesome story, this history of how he started the HeartFit Clinic. Dates back to your dad, because he had heart problems at a very young age.
Of course, yeah.
Right?
Yeah, my father had heart disease at a young age. I was just a young kid at that time. And so I remember him having a heart attack at a young age at 38 and 42 years old. He had bypass surgery. And then at bypass surgery, he was told, I fixed all your pipes and your plumbing's all clear. And it was not just a few years later than that he ended up with another heart attack. And at that time, I was now in school, and I ended up changing my career from working with athletes to then working with cardiac patients. And this is back in the late 90s now. And so I've been working with heart disease rehab and prevention since then. And I started my career at Total Cardiology. So my dad was my inspiration for getting into that field. But really what fueled my passion going forward was the changes that we started to see in patients. And so at Total Cardiology, I was with some of the best cardiologists, mentored by some of the best cardiologists in the city, and had a really great time in understanding the foundation of cardiovascular disease. But I saw gaps there. And so I was headhunted to go to Dubai, open up a clinic there and in Kelowna, and then I started the HeartFit Clinic in 2007. So,
well, I'm going to tell you something. You're a pioneer in the industry. I've been visiting with you a lot. I've learned a lot about it, and I know that you're a pioneer. A lot of our listeners that have heard you before, like, that Diamond sounds like that HeartFit Clinic is something.
Yeah.
But you got to tell you folks, Diamond is just got this gigantic smile because of this major conference he came back from, and it was like everything that you have discovered and that you're working on. It's everybody gets it. They really see it. So tell us where you were. Yeah.
So I was just in Montreal. I was speaking to cardiologists and cardiac surgeons, and it was at the World Congress of Cardiology. And I had two keynote presentations. One was navigating heart disease and where's the gap between family doctors and cardiologists, and I'll get into that in a second. And then the second talk I did was beating heart disease. How do we beat it, and how do we treat stable artery disease and cardiovascular disease? And so those are the two talks I did. And really, I think, and I'll get into that part of it because I know the number one thing was, while I see my family doctor, I see the best cardiologist, and the concern, or even, you going to the States and getting all this private stuff done. The fact is that we're following an archaic model. And no disrespect to those people that are still doing that, but those people that understand the gap that we fill in our healthcare system, that's what we do. And so I'm going to just quickly talk about the difference between the HeartFit clinic and your family doctor, because many times people will say, well, my doctor's got me under control. I get physicals done all the time. And I've been doing this for almost 20 years now. And I can't tell you how many times I've had people come after a heart attack say, well, I had a physical from my doctor or even saw a cardiologist. And just, months ago, how can I have this heart attack? I thought everything was okay. So let's talk about what happens at the family doctor level. When you go to your family doctor and you want to know what your risk is of a heart attack or stroke, they'll throw you into a calculation, which involves looking at your blood pressure, diabetes, age, and your cholesterol. Now, the concern with that is that the majority of people that end up in the hospital with heart attacks and strokes or cardiovascular disease in general actually have normal cholesterol profiles, or what we call normal heart scores from seeing your family doctor. So at a family doctor level, and another thing is that the majority of people that have heart disease or cardiovascular disease actually have normal cholesterol profiles, things that we would never have treated. And so at the family doctor level, when we open up that toolbox of the family doctor, there's not much in there to see where your risk is of a heart attack or stroke. Because if they look at cholesterol, well, the majority of people that have heart disease have normal cholesterol profiles, so it goes beyond cholesterol. And then number two is that we look at that part of it and we throw you into this heart score, and the majority of those people are borderline to low risk, and only the high risk get treated if you have diabetes, high blood pressure, or even high cholesterol for that matter. And I'm on this new wave of thinking in terms of cholesterol as well, because I shouldn't say I don't think. I know cholesterol is not the cause of cardiovascular disease. We've seen enough literature out there to show that cholesterol is not what causes heart disease. It's inflammation, and I'll get into that in a little part of it. So we know now that at a family doctor level, there's not much that we can do to see where your risk is of a heart attack or stroke. So the HeartFit Clinic bridges that gap there to help those family doctors. So those family doctors that know about us understand that gap's being missed, and they say, okay, well, I'm going to refer you to the HeartFit Clinic to get some tests to see where your risk is of a heart attack or stroke. So some doctors will even bypass that and go to a cardiologist, right? And they'll say, okay, well, you know what? I'll refer you to the cardiologist here. And the cardiologist is following an archaic model, as is the family doctor. So what I mean by that, and what I mean by archaic, and with no disrespect to that, because there is some value in doing these tests still, but the point is that we're looking for a plumbing problem. And cardiologists are not plumbers. In fact, they went to school a lot longer than they did for plumbers. And I think many cardiologists don't even know how to even use a plunger for that matter. But the point is that they're not plumbers. They're medical doctors that have gone through extensive training to understand the heart, right? And so, but when we look at artery disease, we're still new in this pathophysiology and understanding the complexity of an artery and why we end up with heart attacks and strokes. And now we're starting to get it, I think. And now the literature is starting to get out there. So my point is that let's say your family doctor refers you to the cardiologist. And let's say he's checking you because you already have heart disease, or he wants to know where your risk is of a heart attack or stroke. They'll do a test called the exercise stress test. And it's been around forever, longer than me for sure. I think since the 40s or 50s. I don't know the number for sure, but many, many decades. The point is that with an exercise stress test, you can have this test done, and it's only looking for advanced stages of a disease. So if we look down through the pipe of an artery wall, we look inside there, the artery's got to be 80% or more blocked before it starts to show up on a stress test.
Wow.
Right? And so we know that, at the HeartFit Clinic, we bridge that gap because there's a big gap between that and seeing your doctor. But I'll talk about the next step from there, because I do not like the stress test results as to what the cardiologist tells the patient. And here's the concern. Cardiologist, you got the best cardiologist in the city, and he'll tell you the same thing. We've done a stress test. There's no blockages. You're okay. Go home. And I don't like that answer. And number two, we've done the stress test, and we need to do the further testing. And I don't like that answer too. And I'll explain that in a little bit. But the HeartFit Clinic bridges the gap there, because now you're getting into more invasive radiation testing. And what's worse is that you're telling a patient that, look, you don't have any extensive blockages, so don't worry about it.
Yeah, you're good.
Yeah, don't worry about it. But the problem is, and here's the biggest thing that our listeners need to listen to, and this is what we focus on at the HeartFit Clinic, is that the majority of heart attacks and strokes occur with blockages that are less than 50%.
Wow. That's staggering, hey?
Yeah. And so it's hard to even think about as a lay person.
It's contradictory. Like, it doesn't make sense.
Yeah, because we're thinking in an archaic model. It's not a plumbing problem.
Being clogged.
Yeah, it's not cholesterol that accumulates to these walls of the arteries, and it goes from, I talked about earlier with you today offline, is that, imagine your arteries having these big lane highways in Toronto, for example. They got 10 lane highways going down through there, and, each lane closes up every, as I eat a burger or I eat something, whatever it is, and each lane starts to close up over time. And now I have 8 lanes that are blocked up. And if those last 2 lanes block up, I'm going to have a heart attack. That's furthest from the truth. What happens is, and more importantly, how I want our listeners to understand, and this is what we educate our patients at the HeartFit Clinic, is that these arteries are like are muscle, right? They're not pipes. And what happens is that when it ends up having a blockage, it's like a pimple on your face. Mm-hmm. And everyone's had that pimple on the face where it's popped open and pus and bled. And I don't mean to get disgusting, but imagine that happening inside your artery. We have these little pimples inside our artery, and that's why the majority of heart attacks and strokes occur with blockages that are less than what a cardiologist can diagnose on a non-invasive basis.
Okay, we have to take a break. So much more to come. This is Talk to the Experts. Diamond Fernandes, he's the director of the HeartFit Clinic. Reach them by calling 403-870-4348, or you can go online at heartfit.ca. So much more to come. Stay tuned.
I could just keep...
Hello and welcome back to Talk to the Experts here on 770 CHQR. I'm Betty Jo Kaiser, and joining us today is Diamond Fernandes. He's the director of the HeartFit Clinic. He's also author of the book, Beating Heart Disease. You can reach the HeartFit Clinic by heading to heartfit.ca or give them a call at 403-870-4348. That's 403-870-4348. Long distance is 1-877-700-4348. So at the top of the show, we talked about Diamond's journey to Montreal at the World Congress of Cardiology.
Yeah.
And keynote speaker, not once, but twice.
Yeah, it was fun.
No kidding. And you met a lot of like-minded people. Did you guys actually have, at the cocktail hour, talk about the conversation of, we got to stop saying we're cleaning out the pipes.
Yeah. And
we got to start saying it's inflammation.
Yeah.
Did you meet like-minded doctors and others?
Yeah, and especially what we're doing at the HeartFit Clinic, because we're the only clinic in that I know of that is focusing on this part of it. Now, the test that we do, we have a test to see, in the top of the hour, I talked about the majority of heart attacks and strokes occur with blockages that are less than 50%. And so you could see a cardiologist, get a clean bill of health, or you can even get an angiogram done, which is going right inside the heart muscle and seeing these blockages. We don't know where these vulnerable blockages are, or those vulnerable pimples ready to pop.
Right.
We have nothing or no way to tell. But the HeartFit Clinic has a test to see where that risk is of that pimple popping inside your artery. And so it's a test called protein unstable lesion test, where we look for unstable lesions, which are blockages, and we look for specific protein markers as it relates to that pimple popping. In addition,
I just have to ask how you test for that. Is
that
a blood test?
It's a blood test, and it's specifically looking at the protein markers that are, there are specific protein markers that we look at that's looking for that unstable lesion, unstable blockage.
Okay.
And so that's one of the biggest tests that we do. But we also look at artery health and we look at artery function. We do an ultrasound to see where the risk is of a heart attack or stroke that way. We look at the health of the artery wall. We look at the arteries as a pipe, not as a pipe, but as a muscle. Mm-hmm. And so we have a test where we look at the reactivity of the arteries as well. And then they
should be elasticy. They're not stiff boards.
Absolutely.
They should be like a garden hose. That's
exactly.
well cared for.
Yeah, and we don't know what to do from that part of it. And so in addition to that, we have tests to see particle size and cholesterol markers, and we do a fitness assessment to kind of find a safe level for people to be exercising at, because exercise is the best medicine. So there's all these different things that we can see that kind of, that bridges the gap between a family doctor and a cardiologist, right? And so when you get a clean bill of health from a cardiologist, you even come to us because we want to know where your risk is of that inflammatory disease. It's not about cholesterol. I can confidently say that, and I don't know why we're still on that path of cholesterol, but it's, and I'm not saying it just goes beyond cholesterol, and we know that. We know that now. It's an inflammatory disease. We want to look for those vulnerable plaques that are ready to erupt, and that's what the HeartFit Clinic focuses on. We bridge the gap between looking at what a family doctor does and looking at what a cardiologist is looking at. And so we bridge that important gap in our healthcare system. So, yeah.
So the thing with the HeartFit Clinic, it's, like you said, to your knowledge, it's really the only place in this part of the world you can get this done. Mm-hmm. If I had the means to go down to the Mayo Clinic or the Cleveland Clinic,
yeah.
I heard you talk about Dubai earlier in the hour. Some of this stuff is very easily accessible.
Of course.
But the HeartFit Clinic here in Calgary, this is the bridge.
Yeah.
It's the only place you can get this done.
And that's what we do from a primary prevention. So what I mean by that is that people who are looking for cardiovascular disease risk, whether you've had it in the past or looking to see where your risk is to avoid that heart attack or stroke, I always say the best heart attack is the one that never happens, right? And so that's why people come to see us, is if you want to know where your risk is of that heart attack or stroke, you come to the HeartFit Clinic because we have the best test to see where your risk is of that heart attack or stroke.
Diamond, how would I know? Like, what kinds of people are coming to your clinic? Now, you talked about diabetes.
Yeah.
There are certain markers that indicate you could be at risk.
Absolutely.
Diabetes is one.
Yeah.
Erectile dysfunction is another.
It's a huge one. And I think it really gets dismissed. And I know we like to turn our heads to the side and say, yeah. And it's funny that way, but it's sad in my mind is that if you go see your family doctor and you tell them you have erectile dysfunction, they give you a pill and all of a sudden you're jumping down the street all happy. And that's not if you're having erectile dysfunction, what's happening is that the arteries going to our sexual organs are a lot smaller than the arteries going to our heart. So it's actually a big marker or a big thing to look at to see where your risk is of a heart attack or stroke, to see if you have erectile dysfunction. Many cardiac medications that people are on, the side effect of it is also erectile dysfunction. So beta blockers or, those are big ones as well, even cholesterol-lowering drugs. Side effects are erectile dysfunction. But the fact is that we have an artery or we have a circulation problem.
Right.
And if you're having that, well, we want to know where your risk is, but more importantly, reverse it, right? And that's the fun part that we do. That's where you walk down happy. But it's not an instant fix when you come see us. It's a couple months where we do our treatment options, and I'll get into that part of it in a second here. But, the HeartFit Clinic, we bridge an important gap when a cardiologist says, okay, we've got a blockage, we've got a plumbing problem, I can open it up. That has to stop. That has to stop. You're talking about stents. I'm talking about stents or bypass surgery where we have a plumbing problem and I know we're following an archaic model now.
Right.
And there's, I think we're incentivized to kind of follow that path of let's get a stress test done and let's get a nuclear stress test done.
It's always been done.
And,
it's always been done.
But you got to look at things differently now. And let me get that angiogram done and see where that blockage is. And hey, doc, there's a 70% blockage or 80% or 90% blockage. Let's open that up. And that's the wrong way of thinking. And I'm all for using that procedure when it's necessary. So let's talk about that for a second, because I'm not here to slam cardiology. That's not what I'm doing. We get a lot of referrals from that side of things. But the point is that when and where a stent or bypass surgery is best used is when you're in the emergency room.
Right.
When it's an emergency. Don't come and see us. If you're having chest pain or we've got probably the best system and best cardiologists in the city to treat a heart attack or even a stroke for that matter. And so if you're having an emergency, that's what the hospital's there for.
Yeah.
And that's where you do want to get a stent to open up that vessel as quickly as possible to minimize any heart damage.
It's emergent.
Yeah. Or if it's emergent bypass surgery that way too. We got such bad chest pain that we can't even do much anymore, right? So it's what we call acute coronary syndrome or emergency, or actually that heart attack or myocardial infarction.
Can I I think you'll say yes.
Yeah.
Can I just give you two examples
Yeah.
of two people I know that have had stents? Folks, if you're just tuning in, this is Talk to the Experts on 770 CHQR. Diamond Fernandes, the director of the HeartFit Clinic, joins me. I'm Betty Jo Kaiser. Check out their website at heartfit.ca, number 403-870-4348. Just picking up from what you said. One night my mom called me many years ago. She had all these strange symptoms. I said, Mom, you got to phone HealthLink because I am not a nurse. I cannot triage you over the phone. By the time she had gotten through, I think her fourth or fifth symptom, the ambulance was already at the door. They whipped her up to the foothills. They opened up the artery with a stent, and she was good to go. Okay, that's story number one. Story number two, a friend of mine. How's your folks doing? Oh, they're great. Dad went to the doctor the other day, and he's getting a few more stents put in. I'm like, whoa, what do you mean? Was he having a heart attack? Was he whisked to the hospital? No, just having a few more stents put in. And I was shocked to hear that it was like a casual, this is how we're treating this. And I wanted him to get his dad on an airplane to Calgary to get to the HeartFit Clinic because my mom needed that stent.
Absolutely.
That night, that saved her life.
Absolutely. And that's very important.
But to hear this other, and it was just 2 days ago, and I'm like, okay, this sounds like this is old school treatment. This is a Band-Aid, and we need to move past it.
Yeah. I don't, so there's, I'm talking with literature too. I'm not just saying this because I believe in it. The HeartFit Clinic is the only clinic that has one of the best treatment options to treat stable coronary artery disease, or has that, and it's called external counterpulsation therapy. One of my favorite treatment options for helping patients with, we'll call it the plumbing problem, or if you have poor circulation, heart failure, external counterpulsation is one of my favorite treatments to do that. In the second scenario, and maybe even the first scenario, depending on what's going on with your mom, the second scenario where you talk about someone getting elective, meaning they're parking the car, getting an angiogram done, and they're saying, okay, honey, I'll be right back. I'm just going to get this test done. And you end up getting a couple stents put in. That's got to stop. And the reason why is because now the trials are showing that. And there's the Orbita trial that just came out in November that talked about there's a placebo effect with doing stents. The Courage trial showed that medical therapy is just as good as doing a heart stent.
Wow.
There's exercise versus stent. There's, the point is that there's a time and place to open up an artery. And if you have artery disease, that's what the HeartFit Clinic focuses on.
Okay. This is Talk to the Experts on 770 CHQR. Diamond Fernandes still sticking around. We still have more to talk about. He's from the HeartFit Clinic. He's the director there. He's also written a book, Beating Heart Disease. You can reach him at heartfit.ca or 403-870-4348. I'll repeat that information when we come back. But for now, it's time for a break. Welcome back to Talk to the Experts here on 770 CHQR. I'm Betty Jo Kaiser, and joining me today is Diamond Fernandes. He is the director of the HeartFit Clinic, also author of Beating Heart Disease. You can reach the HeartFit Clinic by checking out their great website. Tons of information there. That's heartfit.ca. Reach them at 403-870-4348. That's 403-870-4348. Out of the calling area, 1-877-700-4348. Diamond is fresh off a trip to Montreal, the World Congress of Cardiology. He was the keynote speaker not once but twice, talking about the work that he and his people are doing at the HeartFit Clinic here in Calgary, and how you're assessing and treating heart disease. It's very exciting. Where do we go from here? What's next?
So when you come see us and you want to know where your risk is of that heart attack or stroke, if you, whatever, and that age comes to different people, because we get 35-year-olds or 30-year-olds into our clinic because they want to know what their risk is of a heart attack or stroke. Or I'm just turning 40, I want to know what my risk is. Or just turning 50, I want to know what my risk is. Or whatever age that might be for some people in their head, whatever that might be. The point is that you don't have to go down that path of a heart attack or stroke. And that's my favorite part, is actually watching people reverse that disease process. And by following our principles, and I call the 3 E's. And so the 3 E's are exercise, external counterpulsation, which is the treatment that I'll talk a little bit about that part of it as well. It's one of my favorite treatments to really reverse a heart disease process. And number 3 is education, obviously following on nutrition, supplements, stress management, that type of thing. So, yeah.
Okay, so I go to the doctor. They may or may not refer me to a cardiologist. I end up at the cardiologist. They do a stress test.
Yeah.
Can we just talk about that stress test?
Yeah. And so the problem with the stress test is that I still think it's a valuable test to get done. And you know what's cool? And I'm going to bypass that, no pun intended, but I'm going to come back to that in a second. There's this new machine that's coming out, and I'm putting a plug for this other company now. But the point is that at the Hartford Clinic, we do some really innovative tests to see where your risk is of a heart attack or stroke. There's a new machine coming out in the next couple of years that's going to replace the stress test.
Really?
Yeah, and it's going to take a while to do that because we're, the billing and all that side of things. But
revolutionary.
Revolutionary. Yeah, it's looking. It actually can listen to turbulence, velocities, and all that part inside an artery wall.
Wow.
Right inside the heart. So you place this oscillation device on the heart, and it can tell if you have blockages. So
that's cool.
Really cool stuff coming about, and it's actually out in Ottawa, in the Ottawa Heart Institute. A little plug for my friends out there. So anyway, the point is that I don't like the data that comes back from a stress test. One, a cardiologist is telling you, look, you have a clean bill of health. Go on as you are, or everything's okay. And I don't agree with that because the majority of heart attacks and strokes occur with blockages that are less than what a stress test can pick up.
Wow.
Okay. Number 2 is that the cardiologist says, look, we need to go on to further testing. We need to do a nuclear stress test or a myocardial perfusion imaging or a thallium or MIBI scan. Those are all different terminologies for the same test. And what I don't like about that test is it's told it's non-invasive, but it's actually about 800 chest x-rays, and it's a radioactive dye that goes inside of you. And there's a time and place for using that test, and the value or the information gleaned from that test is quite valuable. And in all honesty, the best information that's gleaned from that test is the fact that I can see the calcium inside the arterial wall. And so the concern with that, again, is that it's only looking for major blockages, right? And so, again, you'll get that clean bill of health. Or what's worse is that you're sent to the cath lab, which is now you're seeing an interventional cardiologist. And now we only have one in the city of Calgary, which is at Foothills Hospital. And now you get referred to doing an angiogram to see what's going on inside the arteries. And many people, I know it's kind of cool to kind of see what's going on inside the arteries, but this is an invasive test. Mm-hmm. It's a catheter that goes through your wrist or through your arteries of your groin, and it comes in and it's a guide wire that's coming in. And imagine your arteries. If the listeners out there, just make a circle between your your thumb and your index finger. That's what the inside of your arteries look like. It's all skin, right? And if I have a guide wire that are kind of messing around inside there.
Stop poking.
We don't feel that inside, but you're actually causing little nicks and problems to the arterial wall. And so the point is that there's a time and place for that angiogram. And the time and place is if it's an emergency. Like if you're in the emergency room having a heart attack or acute coronary, like an acute syndrome or acute chest pain, whatever. The point is that if you're not, that's not the place to be. Mm-hmm. And knowing where your blockages are, I got a 60% blockage there, or I got a 70% blockage there. Or, I used to work at Total Cardiology in downtown, and I heard the patient say, I got a 70% and 40%. And, it used to be talk about all these percentage blockages. It doesn't matter, is my point. The point is that on a stable side of things, meaning if I'm able to walk around and it's not an emergency, for those people who are walking around with stable coronary artery disease with 70%, 80%, 90% blockage, whatever the blockage number is, the point is that the majority of heart attacks and strokes occur with blockages that are less than 70%. And, the interventional cardiologist can open up those other arteries that are greater than 70% to restore blood flow. But that doesn't show any benefits anymore. Mm-hmm. The literature's showing that. And I wish that we'd see more and more people referred to cardiac rehab, even just getting an exercise program. We're going to see a lot more benefits that way. We're making sure they're on the right medical treatment profile.
Exercise is the best medicine.
Yes, and also external counterpulsation.
We have to hear about that.
Yeah.
Folks, if you're just tuning in now, I'm Betty Jo Kaiser. This is 770's CHQR's Talk to the Experts. Diamond Fernandes joins us. He's the director of the HeartFit Clinic and author of Beating Heart Disease. You can reach them at heartfit.ca or 403-870-4348. Let's talk about this external counterpulsation therapy, because there's only one place you can get it in this little part of the world, and that's at the Hartford Clinic here in Calgary.
Correct, yeah. I smile when I see this because it's not an instant gratification type of fix, right? It's patients come on the treatment, they're on there for an hour each time. We do 35 of these treatments. So they're with us for a couple months, and we get to see them and get to know them, and we get really intimate with them. And that's another one of my favorite things to do. And the nurses have a good time with that part of it, educating the patients and understanding other things that they can do to really reverse the disease process. And so patients lie in this bed, and you can imagine there's little blood pressure cuffs or bigger blood pressure cuffs that go around the calves, the thighs, and the buttocks. And it sequentially inflates and it pumps blood back up to the heart. So basically what's happening is when the heart contracts, the cuffs relax. Mm-hmm. When the heart relaxes, the cuffs contract. And so that's the counterpulsation. So when the heart contracts, the cuffs relax. When the heart relaxes, the cuffs contract. And it's a counterpulsation that's happening. What's happening in basic terminology is that, I can get more into detail when you call us, is that the premise behind it is that we're increasing a massive amount of blood flow inside the heart muscle. And when we do that, three big things happen. And this is my favorite things, is that you end up helping the heart function better, mm-hmm. right? Number two, you end up having the arteries function better. The arteries are a muscle, right? They're not a pipe. Right. And I talked about how the majority of heart attacks and strokes occur with blockages that are less than 50%. Imagine that pimple about to pop on your face. Imagine if we can strengthen that skin over that pimple, right? And minimize that inflammatory process, right? And lastly is understanding the growth of new arteries. And at the Hartford Clinic, we grow new vessels.
Oh, that's exciting. Right? That's really exciting.
And so external counterpulsation is one of the best treatments to grow new arteries, to grow new vessels, to improve artery function, heart function. And when we do that, so many good things happen. We get patients, minimizing their angina or chest pain medications. We get patients who are ready to have a heart stent or bypass surgery, and we take them off of that list. Wow. We get patients who have already heart disease and they have known artery disease, and they do this and they feel better. The point is that it's a very, and the reason why I believe it's not accepted, even, this treatment's done all over in the States.
Yeah, this is not new.
No.
This is not new age, cutting edge, brand new.
No.
You can fly down to the Mayo Clinic and get that done.
Yeah. And the Hartford Clinic is very evidence-based. We're very, it's not a, let's try this, it's a very evidence-based clinic to see where your risk is of that heart attack or stroke, and more importantly, reversing that disease process. And so, when we do external counterpulsation therapy, we see improvements in artery health. We can prove that. We can actually show improvements from one treatment to another and reversal of the disease process. We've shown that number of times. And I've got to put more of our case studies up, but we get so many and I get bogged down with all of them. But, come to our clinic and I can definitely share with them. And there's lots of testimonials, of course, with patients on our site.
Yeah, you got to check out that website. Yeah. It's heartfit.ca. Great information on there. Give them a call. Ask a few more questions, book an assessment. It's 403-870-4348. That's 403-870-4348. Outside of the calling area, 1-877-700-4348. Again, the website is heartfit.ca. We do have more. I'm Betty Jo Kaiser. This is 770 CHQR's Talk to the Experts. Diamond Fernandes from the Hartford Clinic, and I will be back after this. Welcome back to Talk to the Experts here on 770 CHQR. I'm Betty Jo Kaiser. Diamond Fernandes, director of the Hartford Clinic and author of Beating Heart Disease, has been joining me this hour. And if you want more information, I strongly encourage you to check out the website, heartfit.ca. Great stories on there and lots of great information. You can also reach them by calling 403-870-4348, 403-870-4348. Out of the calling area, 1-877-700-4348. Diamond, people will call the clinic, make an appointment.
Yeah.
Takes a week or two to get in.
Yeah, about that. Yeah.
The actual testing, the assessment, a few hours.
Yeah, you're in our clinic for a couple of hours at least to go through all our stuff that we do. And
then the tests come back.
Yeah, and we go over a care plan after that.
how long does it take between?
It takes about a week or so to get the words. Yeah.
And the care plan is as varied as every patient.
Yeah, it's varied. I mean, sometimes we're in there for half an hour with them to almost 90 minutes.
Sure.
So it depends. And, usually the spouse comes along at that time or significant other.
And the plan would include ways to manage stress, a proper exercise plan, a safe exercise plan.
Yeah, supplements,
food, nutrition, and ECP, external counterpulsation therapy. We talked a little bit about that earlier in the hour. The only place you can get that particular therapy is here in Calgary. And I love how you light up when you talk about it because you've seen so many people's health improve.
I'm so confident that ECP works that I'm willing to guarantee that it works.
I love that.
I know that sounds funny, but when you've been doing enough patients that we've been doing, and every person almost comes off the bed with the results that we expect to see. I mean, that's what it's all about for me. And there's some cases where not with us, but with patients, they can, the idea is for me to keep people alive, right?
Yeah.
And so, more importantly, improve their quality of life, right? And if you have artery disease, there's always that risk of a heart attack, right? There's always that risk of something going on. But if you're not eating well, if you're not exercising well, external counterpulsation, all those things are very important things to help out with your heart health. And so to me, and I wrote a whole book about, what you can do to beat heart disease.
That's right, beating heart disease. Yeah. So I just want to talk about the kinds of people that go there. So you've said 30-year-old athletes, folks that have already had heart attacks, folks that are maybe reaching milestone birthdays and are curious about where their risk is. People that have diabetes, high blood pressure, abnormal cholesterol. I'm not a big fan of taking cholesterol-lowering pills on certain patients, and so sometimes, especially on a preventative level, I'm not the biggest fan that way. But the point is that it's a treatment option. I think that's following an archaic model, right?
Where we think about cholesterol just building up inside the artery wall, and that's not what we need to worry about. We need to worry about lowering inflammation to the arterial wall, lowering that pimple popping, and so. Those who have high cholesterol or abnormal cholesterol or angina pain. Yeah, absolutely.
Any circulation problems?
Yeah, a lot of people have circulation concerns. We see improvements in circulation. It's amazing, some of the stuff that I have. I mean, I don't have the time to go through all our patient population.
But just for those out there, it's it's not just the heart patient. You're really about assessing and treating right across the whole population.
Yeah.
So Diamond is back recently from Montreal and the World Congress of Cardiology. Tons of information, tons of new information and great studies.
Yeah.
Is there a couple in particular you would like to note?
I liked, obviously I spoke a lot about what we do at the HeartFit Clinic and how we bridge an important gap in our healthcare system. And I think, doctors out there need to understand how we fill that gap in the healthcare system. And we're not competing it's not competition for me. It's all about working collaboratively together with other healthcare professionals so that we can see the best for the patients.
Well, and you said at this conference, I mean, you can't swing a cat without hitting a cardiologist.
Yeah.
It's cardiologists. It's people that are in the business of heart health.
Of course. And so, it was obviously a great honor to speak there. And more importantly, the conversations that happened there were really important. And there's really cool stuff now we can get into doing non-invasive or not non-invasive, but minimally invasive cardiac surgeries now, where we can replace valves and replace arteries that way as well. And so there's really cool stuff coming along. I talked about earlier in the show, the HeartFit Clinic, what we do at the HeartFit Clinic is find out where your risk is of that pimple popping. I believe the stress test will be obsolete here in the next number of years because of new technology that's going to be coming out to see I think this technology, and it's non-invasive and safe, and you don't have to require exercise testing on somebody and the time it takes to do that, and more importantly, the accuracy of the stress test. It's not all that accurate. We allow, those people that have artery disease, we allow a third of those people to walk away.
Wow.
With a clean bill of health, yet they still have artery disease. So it's not the best of tests to do as well.
Right. Just getting back to information. So Diamond has written a book. It's called Beating Heart Disease, and people can get that
I think they can get it on their website there.
On the website?
Should be, yeah,
Should be
absolutely.
there. There should be a button.
There should be a button. If
Google
not, you
it.
can call it us. Yeah, you can get it off Amazon for that matter.
Is there an article? People are just curious to learn more. I mean, like you said, you're science-based, you're evidence-based, but there are studies happening all over, and there's really great information.
Yeah, I mean, the Circulation, which is an American Heart Association magazine, and if you want to Google this, it's just coronary artery disease as clogged pipes. And it's Dr. Michael Rothberg that wrote an article about the misconceptual model of treating cardiovascular disease.
And he talks your language.
Yeah, absolutely.
But with different types of analogies.
Of course.
So it's a very interesting read. Really, really good information in there. The author's name again?
Dr. Michael Rothberg.
Right. And the other thing I wanted to mention.
Circulation magazine,
Circulation magazine. Is unusual markers or indications that you might have an issue.
Yeah.
So we went through that whole list of patients.
Of course, yeah. Where your risk is, family history of heart disease, diabetes, high cholesterol, blood pressure, overweight, but also erectile dysfunction.
Yeah, and people kind of go, dee.
Yeah.
But honestly, it's serious.
Absolutely. It is very serious. And, the arteries going to our sexual organs are a lot smaller than the ones going to our heart. And so if we got a circulation problem there, you more likely got circulation problems going on in the heart. So it's actually a good marker. To say, okay, I got to start focusing on some other things here so I can start to improve my circulation. And it's all reversible. Like I said, external counterpulsation is one of my favorite treatments to really reverse that process. And if I take that highway analogy, like I was in Montreal and in Toronto area there, they got all these big lane highways going across, and imagine those as your arteries, right? And people think, okay, well, what your body is really resourceful at trying to do that. And so once it realizes that, we got 7 or 8 lanes starting to close up, we're going to have to start to find some bypass routes, and we're going to start to find some side roads that go around it. And what external counterpulsation does is find those side roads so that we can go past those congested main arteries. If you think about the arteries, they're 3 millimeters in diameter. Yeah. They're not very big.
Teeny weeny.
That's arteries. And then you got arterioles, which are like a tenth of that. And then you got capillaries, which are even smaller than that. And the point is that as cardiology, looking at the old plumbing model, I think it goes beyond that. You want to focus on the smaller vessels and grow new arteries. And that's what we do at the HeartFit Clinic, is we grow new arteries.
Awesome.
Yeah.
Okay, HeartFit Clinic, time for you to make the call. Check out the website first, heartfit.ca. Diamond Fernandes, who's the director there, also the author of Beating Heart Disease. He and his team would love to meet, talk about assessment, talk about treatment. Just start by talking about your risk. A couple of phone numbers for you to jot down. 403-870-4348. That's 403-870-4348. If you're out of the calling area, it's 1-877-700-4348. That's 1-877-700-4348. Diamond Fernandes, thank you for your time today.
Thank you very much.
Great information. Once again, it's the HeartFit Clinic. You've been listening to Talk to the Experts here on 770 CHQR. I'm Betty Jo Kaiser. Have a great day.